I am Paige Randall. I am 26 and I am a corporate lawyer in New York City. Originally, I sought help from Dr. Varma after consulting with some other doctors for a pre-existing herniated disc that had been exacerbated with another injury. I chose Dr. Varma because over the course of my treatment, since the original injury, I had seen many doctors from Washington to New York City. And I was seeing a pain management specialist for injections, exploring the non-surgical route. And eventually the pain got so severe and the injections weren't helping that I got a referral to Dr. Varma from my pain management specialist. And after looking up Dr. Varma, his credentials, his reviews, and meeting him for the first time, I fully trusted him and knew that I wanted him to be my surgeon. When I thought about the prospects of having spinal surgery, it was less the surgery aspect that scared me and more of the spinal aspect and what complications there could be. Obviously, your spine is a very sensitive place on your body. I've had like a shoulder surgery before and it didn't have the same magnitude as thinking about my spine being operated on, but I think Dr. Varma explained every step very well and there were no surprises. There was some nerves, of course, but I think I was at the point where my pain was so bad that surgery was almost a welcome option because I needed to try something else. So before the surgery, Dr. Varma made sure that I got all of my physicals to make sure that I was prepared for surgery, had my blood work done. He met with me the morning of and explained everything, all of the different teams that came in to assist on my surgery, came in, introduced themselves, talked exactly about what was happening, even to the point of like, we're putting this IV in now and there will be another one once you're asleep. So just every step, no surprises. My dad was there waiting the whole time and he was informed throughout, and Dr. Varma went out and spoke to him right after the surgery was complete, and that all helped the process, I think, go much more smoothly. For approximately 3 to 4 days, I was in the hospital receiving inpatient occupational and physical therapy and pain management, which Dr. Varma was involved with. And the physical therapy was just learning how to get in and out of bed, how to not walk again, but using the walker, making sure that I was ready and able to go home. So that I wasn't put in a compromising position to go home and not be ready and end up back there. And Dr. Varma, again, had follow-up appointments, continuously checked on my progress, was also very involved in the pain management and making sure that there were alternatives to narcotics, and was very concentrated on weaning off narcotics as soon as possible and controlling pain in constructive ways through physical therapy and other measures. Today I feel great. I think Dr. Varma was very candid that you're going from intense pain to some mornings of stiffness and soreness, and I think that's definitely true, and I'm glad he was honest about that. And I remember when he told me that, he said, everyone says the trade-off is worth it. And I can say now, 7 months out, the trade-off was certainly worth it. Some mornings I do wake up a little sore, a little achy, but once I get going, take a shower, start my day, my back becomes an afterthought. And what amazes me now is that 7 months later, I don't even need an Advil in the morning to go and sit at my desk all day and walk my dogs and all of that.